You know how sometimes it feels like, even with all the options out there, we're still looking for that right answer, especially for really personal things like mental well-being.
Mm-hmm.
It can be really frustrating.
Yeah, trying to navigate all that. Well, today we're doing a deep dive into something called transcranial magnetic stimulation, TMS for
All
short.
right.
It's a pretty cutting-edge approach that's really starting to change things in mental health treatment.
It really is. It's becoming much more central, I think, than many people realize.
Exactly. It's not just some, emerging therapy anymore. So our mission here is to unpack its expanding role. We want to move past seeing it as just a last resort thing.
Which is how it started for many.
Right. And reveal its potential maybe as a first-line option or something used alongside other treatments for quite a few conditions, actually.
Yeah. The idea is to give you a kind of shortcut to understanding why this shift is happening and, what it actually means for treatment options for you or maybe someone you care about. And just quickly, this deep dive is brought to you by Sabres Medical. You can find them at sabresmedical.com. Okay, so let's unpack this then. Psychiatry.
Yeah,
It feels like it's at a really pivotal moment, doesn't it?
it does.
Medications have been the foundation for so long, and they've helped a lot of people, obviously, but they just don't work for everyone, do they?
No, they don't, and that's a critical point. The reality is, for major depressive disorder, MDD, about a third of patients are what we call treatment resistant.
A third. That's huge.
It's a staggering number, millions of people still struggling significantly. And it's not just MDD. We see similar hurdles with bipolar disorder, various anxiety conditions.
So there's this clear need for something different.
Exactly. A critical need for new, effective options. I mean, you hear it from patients, this feeling of being on a medication carousel, trying one thing, then another.
Right, and dealing with side effects, or it's just not quite hitting the mark.
Precisely. And that's really where TMS starts to, well, shine. It offers safety, it offers adaptability, especially for those groups where the standard treatments have fallen short.
Okay, so given those challenges, it's really interesting to see where TMS is making a real difference, offering hope where maybe other things haven't worked. Let's maybe start with some of the really tough diagnoses.
Okay. Well, one of the most challenging areas in psychiatry is managing bipolar depression. It's incredibly tricky.
Why is that?
Because traditional antidepressants, while they can help sometimes, carry the significant risk of destabilizing someone's mood.
You mean like triggering mania?
Exactly. Pushing someone from depression into mania or causing these rapid, unpredictable mood shifts, it's a real concern.
So patients end up just cycling through different medications.
Often, yes. Cycling through ineffective regimens, constantly looking for something that works without causing, a whole new set of problems. So TMS comes in here as a really compelling alternative, specifically because it's non-pharmacological. It doesn't use drugs.
Okay, compelling is one thing, but what's the actual evidence saying? Is there solid data behind this, especially for bipolar depression?
Oh, absolutely. There was a systematic review which basically pulls together data from multiple studies, in this case, 12 clinical studies.
Kind of like a scientific consensus.
Sort of, yeah, it gives a broader picture. And it showed moderate to large improvements in depressive symptoms from TMS. And importantly, especially in those treatment-resistant individuals.
Okay, moderate to large. Can we put some numbers on that?
We can. So one key finding was a 54% response rate in treatment-resistant bipolar depression.
Wow, over half.
Over half found significant relief. That's a truly remarkable figure for this population. And remission rates are looking similarly promising, too.
And what about the safety side? That's always a concern with new treatments.
Right, and that's another strength here. The side effects are notably minimal, mostly just some scalp discomfort right where the treatment happens. And the seizure risk, which people sometimes ask about, remains very low. We're talking 0.1 to 0.2%. Very rare.
So this really matters for someone who's maybe been dealing with that mood instability or just medication fatigue, as you called it.
Exactly. That feeling of just being exhausted from trying drug after drug with limited success or difficult side effects. TMS offers a different path, a path towards potentially long-term relief without the systemic burden of meds. And it's not just bipolar depression. TMS is making inroads with anxiety disorders, too.
Like GD, panic.
Yeah, generalized anxiety disorder, panic disorder, social anxiety. These often go hand in hand with mood disorders like depression, right?
Which makes treatment even more complicated.
It does, and patients often struggle with tolerating common medications like benzodiazepines or SSRIs. Those are the standard anti-anxiety drugs and antidepressants, so they're always looking for alternatives.
Okay, and is there evidence for TMS in anxiety too?
Yes. A meta-analysis looked at 10 studies and found TMS led to moderate reductions in anxiety symptoms across different types.
And is there a specific target area in the brain for anxiety, like with depression?
Often, yes. Targeting the right dorsolateral prefrontal cortex, the RDLPFC, seems particularly helpful. That's a key area for regulating emotions and decision-making.
And this seems like a good fit, again, because it avoids those systemic side effects you mentioned.
It's ideal, really, because it's non-systemic. You're targeting specific brain circuits directly, not flooding the whole body with medication. That's huge for people sensitive to side effects.
Right.
And what's really exciting now is how personalized TMS is becoming for anxiety.
What do you mean by personalized?
Well, clinicians are starting to use things like EEG, that's electroencephalography, mapping brain activity,
Okay.
to actually guide where they place the TMS coil for maximum effect, and even adjusting the stimulation frequency, the pulses, to better match an individual's specific brain patterns.
So it's getting much more tailored.
Much more targeted, yeah. A truly customized approach.
That precision for anxiety is fascinating. But it does raise a question. How does this non-systemic targeted approach help with something as, well, complex and deeply rooted as PTSD?
That's a really excellent question, and TMS has shown significant promise there, too, in post-traumatic stress disorder.
Okay.
We have randomized clinical trials with both veterans and civilians reporting really meaningful reductions in PTSD symptoms.
Just with PMS alone?
It can work alone, but here's a key insight. The effectiveness often seems amplified when TMS is integrated with good trauma-informed psychotherapy.
Ah, so it's a synergy.
Exactly. That synergy really seems to set it apart for PTSD.
And how does it work? What's the thinking behind why it helps PTSD?
Well, the proposed mechanism is pretty interesting. It's thought to help rebalance activity in brain regions that are crucial for emotion regulation.
Like the amygdala.
Precisely, the amygdala and also the medial prefrontal cortex. Areas often disrupted by trauma.
So by rebalancing those areas,
It seems to lead to improved emotional processing, less reactivity to triggers, better ability to handle those intense emotions, and again, without needing medication, which offers a really distinct path to healing for people living with trauma's effects.
so if we step back and look at all this, what does it mean for the future of treatment? You mentioned medications maybe being like a broad spectrum approach. Is TMS more like a precision tool?
That's a great analogy. A precision laser, perhaps. Yes, it allows for a fundamentally different approach.
How so?
Well, the true promise of TMS lies in its incredible flexibility. I mean, we can customize so much. The frequency, for instance.
Like how fast the pulses are.
Exactly. We can use 1 hertz, which tends to calm overactive brain areas, or 10 hertz to stimulate underactive ones. There's even theta burst stimulation.
Theta bursts.
Yeah, it's a newer protocol that can deliver a full treatment dose much faster, sometimes in just like 3 minutes.
Wow, 3 minutes.
Yeah. And then we can vary session lengths, choose different types of coils, like a figure 8 coil for very precise targeting, or an H coil that covers a broader area.
So the psychiatrist really has this adaptable toolkit.
An incredibly adaptable tool, yeah, to really match the unique neural signature of each patient. And it's getting even more precise. There are emerging innovations like neuronavigation.
Like GPS for the brain.
Kind of, yeah. Using brain imaging to guide the coil placement, and quantitative EEG mapping measuring electrical activity to pinpoint over or underactive spots with amazing accuracy, right down to the individual level.
That sounds incredibly precise, almost futuristic. But for someone listening, maybe it sounds a bit experimental or too good to be true. Should we address that?
That's fair.
Because you hear quotes like one from Dr. L. Kumar, a board-certified psychiatrist, saying, "The future of psychiatry lies in personalization, and TMS is already there. It's the first tool I reach for when medication has failed or isn't an option." That's a strong statement.
It is a strong statement, and it reflects the growing confidence. But yeah, it's important to clarify. While these personalized techniques sound advanced, the core TMS technology has been around for decades.
Okay.
It's undergone rigorous testing. So this level of personalization isn't just about better outcomes, though that's key. It also really strengthens the relationship between the patient and the provider.
How does it do that?
Well, patients feel like their treatment is genuinely tailored to them, to their specific needs. And providers have objective data to guide decisions. It builds trust, engagement. It shifts away from just trial and error.
Towards something more targeted, more data-driven.
Exactly.
Okay, so beyond just how well it works, what about the practical side? For someone actually getting the treatment, what are the benefits?
Well, one of the biggest practical advantages is the side effect profile we touched on earlier. Compared to many medications, it's minimal.
So you're avoiding things like weight gain, sexual dysfunction, that sort of thing.
Correct. No weight gain, no sexual dysfunction, typically no sedation or that cognitive dulling some people experience with meds.
And that must make a huge difference in whether people actually stick with the treatment, right?
It makes a massive difference. It translates directly into higher treatment adherence, fewer dropouts, and just greater overall satisfaction. People can maintain their quality of life during treatment.
And you mentioned the convenience factor earlier, too, with things like theta burst,
Yeah.
making sessions much shorter.
Yes, that intermittent theta burst stimulation, sometimes getting sessions down to as brief as 3 minutes.
3 minutes.
Yeah.
You could almost do that on lunch break.
Absolutely. And that convenience is a real game changer. It allows people to fit TMS into their daily lives, work, caregiving, studies without major disruption.
It removes a huge barrier to getting consistent care.
A really significant barrier, yes.
So if we connect all these dots, the effectiveness, the personalization, the convenience, the fewer side effects, this feels like more than just a new machine. It feels like a real shift in how we approach mental health care.
I completely agree. It's a fundamental shift. And the growing evidence base, all this data we're seeing, it's really a call to action for providers, for clinics.
Right.
Meaning TMS deserves more than just being a niche treatment or only something you try after everything else fails.
It should be considered earlier.
It should be considered a proactive strategy, yes, not just a fallback. And seeing it integrated successfully into all sorts of settings, outpatient clinics, hospitals, private practices, that's a huge opportunity.
An opportunity to, what? Raise the standard of care.
To elevate the standard of care, absolutely, and offer real tangible hope to people who struggled for a long time to find relief.
And I suppose devices specifically designed for this, like the Blossom TMS systems you mentioned earlier, are key to meeting that demand.
Exactly. You need reliable performance, precise targeting capabilities, and the flexibility to support all these different protocols we've talked about.
Okay, so let's try to sum up our deep dive today. TMS. It really is sounding like a kind of paradigm shift in modern psychiatry.
I think that's fair to say.
It's patient-centric, it's evidence-based, and there seems to be so much room for more innovation, whether we're talking bipolar depression, anxiety, PTSD, or even that tough treatment-resistant unipolar depression.
It's a really dynamic field right now.
So maybe a final thought for our listeners to chew on.
Okay. Well, imagine a future where mental health treatment is truly as unique as your own fingerprint.
Wow.
Where interventions are precisely tailored, neurobiologically tailored to your specific brain patterns. Just think. What might that mean? For individuals seeking relief, yes, but also for the entire landscape of healthcare. It's a compelling future to think about.
It really is a future of truly personalized mental health care. Well, this has been incredibly insightful. For anyone wanting to learn more about Blossom TMS, maybe see how it could fit into a practice, you can visit blossomtms.com.
That's blossomtms.com.
Or you can call 833.3buy.tms. That's 833-3BUY-TMS or 833.3289.867. Thank you so much for joining us today and walking us through this.
My pleasure. It's an important topic.
And thank you all for listening to this deep dive into the evolving world of TMS and the future of mental health treatment.